Welcome to the Regional West podcast. Join me to learn about all the great things happening at Regional West and meet the people behind your health journey. As we celebrate a century of care, we are refocusing on the patient experience and reimagining healthcare the way it should be. For moments big and small, we're here for you.
We are Regional West.
Welcome to the next episode of the We Are Regional West podcast. I'm your host, Julie Franklin. Today, I'm joined by Lisa Steele, the Director of Physician Recruitment at Regional West. Thanks for joining me. You have had a very busy year.
We really have, Julie. This year, we've recruited 23 providers to Regional West that will join us this year in 2024.
That's an impressive number. Why is physician recruitment so important?
Regional West is really focused on patient satisfaction, as you know, and one of the areas we felt we could really improve on is the stability and consistency for physician and providers. So we're using fewer physicians that work at Regional West on a temporary basis. They're called locum tenens, and they fill vacant positions until a full-time provider can be found.
It is important that all of our specialties are offered and available when members of the community need our services. So I know there is a time to use the local tenens, but that can be expensive as well if you need to use them.
It is really expensive. The financial impact of locums is significant. The cost of locums has doubled in most specialties since COVID, and it's just not sustainable for any organization from either a financial or a quality perspective. With the recruitment of the 20 physicians and providers last year in 2023 and 23 so far in 2024, Regional West's locum costs have decreased on average by about $400,000 a month since January.
That is a large number. And so obviously then if we're reducing the locums, we need to turn our focus to recruitment. And as we all know, nationwide, the number of hospitals and clinics searching for physicians and providers has increased significantly in the past decade, particularly in certain specialties and in rural areas like western Nebraska, Scottsbluff. With the shortage has come intensified competition among healthcare organizations to attract and retain the qualified physicians and providers. We saw the other day that the Association of American Medical Colleges predicts that by 2036, the United States will face a shortage of up to 86,000 physicians. When you see statistics like that, how do you approach physician recruitment for Regional West?
Over the years, we've really adapted our recruitment strategies to try to appeal more to the providers' changing preferences. We've really highlighted Regional West benefits, our loan repayment programs, relocation assistance, offering them professional development opportunities, ways to participate in leadership in the medical staff structure, and more supportive practice environments.
So when you look back over your 24 years that you've been recruiting for Regional West, is there anything else that really stands out?
A lot really has changed since the pandemic. Physicians and providers are often asking for a better work-life balance, job satisfaction, professional development opportunities that we can provide, and that's in addition to compensation and benefits. They really want personal and career goals to align. They're looking for flexible scheduling. Some want reduced administrative burdens from running their own practice, and also looking for access to advanced technology. So organizations that offer supportive work environments and resources for them are definitely more attractive in a very competitive market.
Well, and that's what we talked about earlier is it's such a competitive market for recruitment, especially to smaller communities like Scottsbluff. I know you mentioned in the past that once you get the provider and their family here, they are often taken back by how impressive our facility is and the large area we cover as a regional trauma center.
That's so true. They're often not from the area, and when they come here, they're so surprised at the wide range of specialties that Regional West offers, from orthopedics, cancer services, the birthing center, the NICU, to rehab offerings.
So how do you go about finding the perfect candidate for our community and region?
We utilize a number of different strategies. We use some recruitment firms, some social networking. We most often look for providers who have ties to the area, a rural background, or even family living somewhere in the Panhandle or just in the region.
Regional West is working hard to not only attract excellent physicians and providers, but also integrate them and their families into the community.
Yes, increasingly providers are placing a greater emphasis on achieving work-life balance. They seek roles that allow them to pursue other personal interests, spend time with their family, and avoid burnout. We found it's important to the providers and their families to connect them with people in the community, churches, other activities, the schools.
So, what are some other things you do to help them meet people?
We have a really great group of providers right now who are so invested in the community and in the hospital here. Just recently, we have a couple physician spouses who have formed a group called Providers Connect, which is going to provide ongoing support to the new providers and their families. They will hold events throughout the year that will hopefully help them integrate into the community. They want to provide a resource book of who to contact for what service they might be looking for. They mentioned that when they moved here, they didn't know anyone, and it would have just been helpful to have a group that they could go to and connect with their families who've lived here for a while.
That sounds like a really good program to have to help support them in their transition to a new community. So, stepping back to the specialties and the physicians that you do recruit for, how do you decide which specialties to look at?
Well, we have a recruitment team at Regional West, and we're always looking at the needs of each specialty. We're looking at the future when some of the providers may retire, what the needs are out in the panhandle. And part of that is done by conducting a community needs assessment, which the community is involved in, the employees are involved in, and the providers are involved in to help us determine what the needs of the future will be.
As I look over the list of all the physicians and providers you've recruited that are joining Regional West this year, one name that really stood out to me is Monica Sarawagi. She's a physician in family medicine. I believe we've had her practice here before.
We sure have, Julie. Dr. Sarawagi completed her family practice residency here through the University of Nebraska and practiced at the Geriatric Family Medicine Clinic for several years. She left in 2017 to do a geriatric fellowship. And earlier this spring, I got a phone call and Dr. Sarawagi said, "Lisa, do you have any primary care openings? I want to come home."
That is wonderful. And the best news is we have Dr. Sarawagi right here with us today. Welcome.
Thank you for having me. It is so nice to be back.
We are so glad you are back and practicing at Family Medicine Clinic in Gering. When you were here before, while practicing, you decided you wanted to get a fellowship in geriatrics. Tell us a little bit about that.
Thank you for asking that question. Practiced in Gering Clinic for almost about 7 years. I've spent a long time in Scottsbluff and Gering area. The interest stemmed from taking care of all my patients who were above age 65 and dealing with complex health conditions and trying to understand the aging process. I wanted to get a little bit more training, become more comfortable so I can provide the best evidence-based care to my patients here. So that's where my interest peaked in for geriatric fellowship.
So many times I hear people comment about the Gering Clinic, how they enjoy going there. And so what do you enjoy most about the Gering Clinic?
Well, I would say what's not to enjoy about Gering Clinic, the community, closely knit community, wonderful people, very friendly. And the bonus point is I still have my staff that I worked with for 7 years. I'm excited and thrilled. I would say 100% everything is great about clinic and the community.
It is so important to offer that service of providing care for our patients who are over 55. How do you approach that a little differently than you would a younger patient?
Oh, absolutely. After doing my training, it definitely changed my perspective of looking at certain conditions or health issues. So how I approach is, number one, definitely the golden guideline is to listen to our patient, especially in their 60s or 65, because each individual have their own unique health condition that requires a personalized plan. They have their own goals, either want to have a quality of life versus some healthy 70-year-old. They still want to participate in marathons. So I'm also very much interested in polypharmacy. I've been in geriatrics now for 6 years almost. Polypharmacy, I love it because there have been so many patients on several over-the-counter medications. They take a lot of supplements, and it's very interesting to know what it can do to their health, especially brain health.
basically you like to see the aging patient
Absolutely.
and really get a whole look at their health from, do they have anything right now that needs addressed? What kind of medications they're taking, what their goals are for their long-term health care so that you can really help them in that journey as they do age.
You got it.
Is there anything else you'd like to share with our audience today?
I would like to take this opportunity to thank everybody in the community, people that have given me so much love and affection, and 7 years spending time here. Definitely, that tells it by itself that Sarawagi definitely loved it here. And also want to thank Regional West from the bottom of my heart, especially Dr. Brown. This time, he was the one who brought me back. So
wonderful.
Special thanks to everybody helping me in this journey.
Thank you. And thank you, Lisa and Dr. Sarawagi, and everyone for tuning in to the We Are Regional West podcast. You can find us on the Regional West website or search Regional West where you get your favorite podcasts.